The CDC says older adults and people with chronic medical conditions are most at risk for the coronavirus. We've got our Dr. Narula here to explain what precautions to take if you or your loved ones are vulnerable. So we keep talking about people who are vulnerable. What does that mean in practice? What conditions are most susceptible to the virus?
Right. So on the CDC call yesterday that they gave as a briefing, they mentioned these conditions: cardiovascular disease, including things like hypertension, diabetes, if you have chronic lung disease, but also if you're immunosuppressed, you have cancer, or you're on some medication that is weakening your immune system. These are some of the conditions that we're talking about.
We're familiar with talking about things that affect the young and the old, and usually those populations are both vulnerable. But
right.
we only have the old vulnerable, but children apparently not. Why?
It's so interesting. So you're right. You usually see a U-shaped curve where at the tips of your U, the kids and the elderly, you're most vulnerable. With COVID-19, we're really seeing kids being spared from severe disease and the elderly being affected. When we talk about ages, we're talking about individuals over 60, but with risk really increasing the older you get, over 80 being at the highest risk. Why might this be? Well, when you look at the elderly, they tend to have weaker immune systems. They also have more of these chronic health conditions. And what we think is that their immune system reaction to the virus may be kind of dysregulated, overwhelming. So they develop what we call cytokine storm. You release all these inflammatory mediators that then damage the lungs. When you look at the kids, on the other hand, what's kind of reassuring for parents is, at least in China, the 70,000 cases they looked at, less than 2% were in those individuals under the age of 19. No children died in South Korea, or no anybody under 30. There were no deaths, and no deaths under the age of 9 in China. Again, how does this happening? You know, kids may have, for some reason, the virus may not replicate as easily. They may have less mature receptors in the lungs, what we call the ACE receptors, where the virus latches onto. And another theory is that as kids, you're exposed to all these other coronaviruses, not COVID-19, maybe you're developing antibodies that are cross-reactive.
All right, are pregnant women more vulnerable in this?
Another thing that a lot of women want to know. So we don't have a lot of data on this, so it's a data-free area. What is the effect on pregnant women, on the fetus, on the infant? What we know is that during pregnancy, your immune system sort of down-regulates so that you don't reject the baby. And also your physiology changes. And this can set you up for being more vulnerable to respiratory viruses. When you look at SARS and MERS, we did see some cases where there was pregnancy loss or miscarriage. So far, in a limited case series in China, we have not seen transmission from mother to baby in the newborns that were looked at, and no evidence of virus in the amniotic fluid or breast milk.
What about smoking and vaping?
Yes.
How does that impact?
Well, if there was ever a reason to quit, here's another one.
Right.
Anything that's going to compromise your lungs is going to increase your risk of being susceptible. We know that smoking decreases your ability to really fight infection. And one other interesting thing is that in China, we see more men dying from COVID-19 than women. And one of the theories is that 50% of men in China smoke, less than 2% of women smoke. So this smoking
that
have a
fact stuns me, I have to say, yeah.
Yes. So
the CDC is now actively saying avoid cruises if you're in this vulnerable population. Are there other precautions that you could say would be wise?
Right. So you saw Stephen Colbert, right?
Yes, right.
Avoid social
Crowds.
gatherings. Yeah. So for vulnerable populations, you really do want to try to stay home. Avoid situations where you're going to be in close contact with other people, where there's a lack of real great ventilation, where you're going to be exposed to the droplets, and even non-essential long plane flights you want to avoid. Stock up on important medications, whether it's blood pressure medicine, diabetes meds, fever or pain meds that you might need, supplies. Avoid high-touch surfaces, so handles, elevator buttons, anything where you could get exposed. And then, this is really important, is to make a plan with your caregiver. What's going to happen? Who's going to take care of me? What if my caregiver gets sick? And then also, people don't like to discuss what they might want to happen in the event that they do decompensate. Do I want a breathing tube put in? What is my end-of-life care look like?
Right.
And these are hard discussions, but important discussions to have.
Some tough decisions. Hopefully people will begin to think about them and talk about them.
Yes.
Thank you, Dr. Narula.